The Community Health Needs Assessment for St. Mary's County, Maryland. I am using the MAP-IT program planning to help me complete the assessment. MAP-IT stands for Mobilize, Assess, Plan, Implement, and Track. MAP-IT is a guide to using Healthy People 2020 in my community. I will be using the MAP-IT framework to help me mobilize partners, assess the need of my community, create and implement a plan to reach Healthy People 2020 objectives, and track my community's progress. St. Mary's County is in the southern tip of Maryland and has over 500 miles of shoreline, surrounded by 3 bodies of water: the Patuxent River, Potomac River, and the Chesapeake Bay. The community has increased by 22% from 2000 to 2010. One of the main reasons for the population growth is job availability. The Naval Air Station Patuxent River provides 22,400 jobs for people in the area. Demographics are the population 111,413, 79% of St. Mary's County is white, 14.4% are Black or African American, 0.4% are American Indian and Alaskan Native, 2.8% are Asian, 5% are Hispanic or Latino, 74.9% are white alone, not Hispanic or Latino. 26.5% of residents are 25 to 44 years old. 26.9% are 45 to 64 years old. 25.8% of residents are under the age of 18. Median household income is $86,987. The socioeconomic factors are poverty, where the median household income is high. In the Lexington Park area, it is considered low income. 18% of the population is living below the federal poverty line. Other socioeconomic factors include access to care and healthy foods and race. Determinants of health are access to health care. There is no public transportation system, and with only one hospital, getting to see a doctor close by can be hard. Many low income do not have a form of transportation or only one form of transportation, so going to the doctor can be difficult. The patient-provider ratio is much higher than the state average. The St. Mary's County has a health care provider shortage area destination for the southern end of the community. Unhealthy weight is also a determinant of health. The overweight and obese population in St. Mary's County is much higher than the state. Substance use. The rate of emergency department visits for addiction-related conditions in St. Mary's County is higher than the statewide average and the goal set by the health department. Binge drinking is highest among adults younger than the age of 45 at 34% and males at 27%. 24% of adults in the community reported binge drinking in the last 30 days, compared to 17% statewide. Tobacco use is also high. In St. Mary's County, adults younger than 45 and males report the highest smoking prevalence across age and gender groups. The priority health issue I decided on is heart disease. It is the leading cause of death in St. Mary's County. 1 in 4 deaths in the U.S. are caused by heart disease. The risk factors for heart disease are obesity, diabetes, alcohol use, tobacco use, poor diet, and physical inactivity. The graphs show the total cardiovascular deaths per 100,000 among races and gender in St. Mary's County, Maryland, and the United States. For races, the graph shows it is more common in African Americans, and it is the same for men. community resources to address heart disease. There are a few resources in our community where residents can find support for heart disease. The Million Hearts Initiative, the Healthy Eating, Active Living Program, Tobacco Cessation Program provided by the St. Mary's County Health Department, and the Chronic Disease Self-Management Program. The findings from the Community Health Needs Assessment show that the prevalent determinants of health in St. Mary's County are also risk factors for heart disease, obesity, tobacco use, and substance use. Access to care is also an issue because it makes it harder for residents to get screenings and for preventative care to happen.